Breakthrough bleeding basically is just the lining of your uterus, your endometrium responding to hormones. So the way that our uterus pretty much works when we're in our menstrual prime is that every month we're biologically programmed to fluff up that lining of the uterus to prepare for a pregnancy. And when we do not get pregnant, there's a hormonal cascade that causes us to shed that lining, which is when we have our period. So sometimes, depending on where you're at, if you're having cycles or not having cycles, we're giving you hormone replacement therapy. Suddenly your body's like, whoa, where am I in that sequence? Am I prepping for pregnancy? Am I shedding? What am I doing? And all of a sudden you get this breakthrough spotting or bleeding. It's just your body acclimating to the hormones, and it's usually temporary and it gets better on its own. If it continues several months into treatment where you're having bleeding that's irregular, that can mean that we might need to adjust your dose, either go down or go up, depending on the character of the bleeding. So it's something that you'll have to talk to your doctor about, so we can determine which way to adjust your medication if that's the case.